Do you know that by reaching approximately third decade of your life, almost 30% of the males would experience hair loss? About 50% of the females up to 50 years of age may also experience hair loss. Whenever we see the visibility of our scalp, we tend to think, what are the treatment options that we may have? It could be medications, it could be PRP, it could be hair transplant, it could be mesotherapy, it could be a non-surgical hair patch or a wig that we may use. Hi, I'm Dr. Mayank. I'm a board-certified plastic surgeon and a diplomat of American Board of Hair Restoration Surgery. Today, I'm going to explain each one of the above mentioned and help you get this basic idea how to proceed with management of hair loss. When we talk about medications, hair loss medications are US FDA approved medicines called as minoxidil and finasteride. We will be talking in detail about these drugs. But for today, the basic concept that you need to understand is that medicines help preserve your existing hair. It would also slow down the progression of your hair loss. Medicines will never bring back your hair, what you have lost. Also, what we need to be very sure about is that the moment we would stop medications, you will have further progression of hair loss the way it was going. Hair loss will always be an ongoing process. It will increase with aging. We cannot stop or treat hair loss by curing it completely. We can only slow down the progression by using medicines. So whatever be the management, what we are going to do, whether it is PRP, mesotherapy, hair transplant, medicines form the base or the pillar of this management. What is PRP? PRP is platelet-rich plasma. It's a component of your own blood. We extract your blood, we centrifuge it, and create the platelet-rich plasma, which is rich in growth factors. When we talk about PRP, it is not an alternate to a hair transplant or to your medicines. It always works in conjunction with medicines. So we go for up to 3 sessions in a span of 6 months. And if we inject this, it is not going to produce any new hair on your head. What it is going to do is thicken the thinned out hair follicles, which we will have to maintain with medicines. PRP may require a booster session every year to just maintain what we are having apart from usage of these medicines. Mesotherapy is another line of management. What mesotherapy is, it is instilling of vitamins and minerals which are important for thickening the existing hair and reducing your hair fall. So mesotherapy could work by injections. It could work by derma rollers on the scalp, followed by the application of the mesotherapy solutions, which are basically botanical solutions. Mesotherapy could also be done with the help of a machine called as electroporation, where we instill the vitamins and minerals without any injections and becomes a pain-free mechanism. These treatments do not work for everyone. Approximately 50 to 70% of the patients may reap benefits of this process. There are several artificial systems available, which may be called a hair patch, a wig, a hair system. What we need to understand is that these are basically artificial skins on which hair fibers are attached. All these systems have their own advantages and disadvantages. So let's first talk about the advantages of hair systems. Hair systems are something which is non-surgical. So if someone is medically unfit, they would be right candidates for this patch system. If someone is looking for extraordinarily high density and a huge coverage to be done in a single time without any surgical intervention, a hair patch is the solution. If someone has very poor scalp donor area or body hair distribution, then also they are good candidates for a hair patch. If someone is having extensive autoimmune disorders of the scalp or scarring alopecias, they would be perfect candidates for an artificial patch or a system to cover the entire part. The disadvantage of a hair system is that the very high density which we get with the hair system may look unnatural on an aging face. The hairline and the temporal triangle, which gives the definition to the face, is almost missing in hair patches or wigs. So it would always look unnatural if you go ahead and look at someone who's wearing a patch. Hair patch or systems would have different attachment ways. It could be attached with the help of clips, with the help of tapes or glues. All these systems have their own drawbacks when we attach such systems on the scalp. If we are using the clips, then they may cause some amount of tractional baldness from those patches. If we are using tapes or glues, they may cause skin changes or a lot of irritation which could be very difficult to manage after a while when we use these such systems. Apart from this, what hair patch also does is that these hair patches would always be lifted from the back side, and it would be visible as a gradient which would be differing from the back angle as well. These hair system would require regular servicing, which would happen at almost every 3 weeks interval, for which you have to go to the same place. If you want to get a haircut of your existing native hair, what you had underneath the patch, you would have to go to the same people to take off the patch and do the same. There are detachable systems, but again, that is not something which is very feasible for most people to do. Hair system would always involve recurrent expenditure where, apart from the servicing cost, every year or so you may have to change the skin which has been used for applying these follicles on top of it. So it is always advisable from my side to all the patients, it's better not to jump in for something that looks artificial. Rather than that, it would be much easier for you to get a transplant done if you are an ideal candidate for the same. Another option is a hybrid system where we may use a hair transplantation for the front and the temporal framework so that it looks natural, and the area behind it in the midsection and the crown could be covered with the help of a patch. The advantage of this system is that if we have a poor donor area and we still want to have a natural look with the head full of hair, it would usually give a gradient of camouflage in a manner that it will look natural and full. So these basically are the options with which we could decide what would be the best solution for us. If you want to take a call on the treatment line, it would always be advisable that you visit your hair expert who would take a call and decide mutually after the conversation with you that what should be the plan and how we should proceed for the same. Wishing you all the best. Take care.